Hello, my name is Nurse Pauline RN. Welcome to my channel. The title of my video today is Fundamentals of Nursing, Exam 1. I am changing my Exam 1, Part 1, from a public video to a private video, and I'm re-uploading a new video today. Fundamentals of Nursing, Exam Part 1. There was some problem in editing. Before I get started, please hit the like button, please hit the subscribe button, and please share this video. Today we're talking about a nurse. She's on the floor and she smells smoke. What does she do first? The answer is first, RACE, rescue, alarm, confine, extinguish, and evacuate. Trauma due to motor vehicle accident. Patient experienced neck injuries involved. What do you do first? Put a cervical collar on to your patient to immobilize the cervical spine. Doctor orders NPO preoperatively at midnight. NPO means nothing by mouth, no fluids, no food. A patient with fractures. Assessment, priority, distal pulses assessment. Assess that the pulses are present. If the pulses are absent or weak, notify your doctor. Patients complaining of redness, warmth, to touch, pain to the legs. Notify your doctor. Your patients may be experiencing DVT, deep vein thrombosis, thrombophlebitis. Patient becomes unconscious. First priority, CPR. Patient complaining of chest pain, call the meds team. Call your doctor stat. Nitroglycerin is ordered sublingually for chest pain. It's a PRN order. But chest pain, you call the meds team. Notify your doctor stat. This is an emergency. Lasix is administered as a IV medication, a PO oral medication, or a IM medication. If you're not able to do it IV, or if the patient is not able to take the medication orally, the route of choice for Lasix is IV. Patient with abnormal assessment, loss of consciousness, or altered mental status, low oxygen, less than 92%, wheezes, stridors, abnormal lab values. These abnormal assessment, you will notify your doctor stat. After giving patient injection, apply pressure to the injection site to stop bleeding. 5 rights before administering medications. Make sure you have the right patient, the right medication, the right dose, the right route, the right time your medication should be administered. Autonomy for patients mean They are able to function independently. The patient makes his or her own decision concerning his or her care. This is the meaning of autonomy for our patients. Ethics is the study of conduct and character. When you're providing a bed bath to a female patient, clean from front to back, prevents UTI, urinary tract infection. Maslow hierarchy of needs. Physiological needs, example, food, water, sleep, shelter, oxygen. We cannot live without these. Second, we have safety and security, emotional needs, financial needs. Please note, hand washing prevents us transferring bacteria to our patients. Hand washing is safety. Love and belonging, friendships and intimacy, self-esteem and family, self-actualization, personal goals are pursued. ABC means airway, breathing, circulation. In CPR, we do CAB, circulation, airway, breathing. Social distancing is 6 feet. Cultural sensitivity. Some cultures do not express pain or verbalize pain. Pain scale is measured on a scale of 0 to 10. 0 being no pain, 10 is the highest amount of pain your patient feels. Nonverbal cues, pay attention to facial grimaces. Respirations are counted for 1 full minute. Respirations are counted for 30 seconds multiplied by 2. If your patient has a history of irregular respirations or is at present experiencing irregular respiration rate, count 1 full minute. Patients using narcotics are at risk for respiratory depression. Narcan IV PRN is the drug of choice to use to reduce respiratory depression. Contraindications for using a rectal thermometers are patients who had rectal surgery, diarrhea, patients with a history of heart problem. Before administering digoxin medications, please check your patient's heart rate. If your patient's heart rate is less than 60, you will have to hold this medication. Heart rate should be greater than 60. There are 4 concepts of nursing theory. 1, the patient. 2, the environment. 3, health. 4, nursing roles. Quinsen education for nurses are based on 1, competencies, 2, safety, 3, patient-centered, 4, evidence-based, 5, informatics, 6, quality improvement, 7, teamwork, 8, collaboration. Quinson means quality, safety, education for nurses. For nursing exams also are based on Quinson. Nursing exams for Quinson examples: continuing health services, continuing healthcare that are hospital service, and end of life, all are based on Quinson. Quinson to be a all are based on Quinson. To be a registered nurse, you'll have to pass your Nclex examination with an associate's degree or a Bachelor of Science education. Nurses practices in their own state's Practice Act. Each state may vary for licenses. LPM is a vocational nurse responsible to work directly with a registered nurse. LPN, they are allowed to insert Foley catheters, insert IVs, administer tube feedings, dressing changes. Nurses working in the community selects alternative healthcare treatments for her patients and alternative care sites for her patients. Preventive and primary care medicines examples are promotional care, health promotion, nutritional consults, well baby care, vision screening. These are all primary care. Secondary care are radiology procedures, laboratory diagnostic procedures. Tertiary cares are your hospice cares, your long-term nursing cares, nursing homes. Empathy, the nurse emphasizes with her patients. She understands another person's condition. Before administering medications, check to see if your patient has an allergy bracelet on. You always check for allergic reactions to medications. When a registered nurse has a needle stick, what does she do first? She notifies her manager. That's what she does first. Short-term goals are outcomes achieved in few days to 1 week. Long-term goals are achieved weeks or months to be accomplished. Stages of grief. First, shock and dismay, denial. Second, anger. Third, bargaining. 4, depression. 5, acceptance. Nurse is discharging our patients. She will make sure our patients are able to verbalize understanding of our prescriptions and instructions. Nurses will have patients demonstrate return demonstration of injections. Example, heparin injections. Example, insulin injection. That's very important. Make sure your patients know how to do this before they go home. On discharge, make sure your patient If they are non-English speaking, the nurse should notify a hospital-based interpreter. Do not use staff members to interpret discharge instructions. Do not use family members to interpret discharge instructions. We need hospital-based interpreters with knowledge of medical terminologies. You can also use your language phones at the bedside while you're discharging your patients. In your time management, learn how to work along with your collaborative team. Example, learn to work around your respiratory therapist, your physical therapist, your occupational therapist, your nutrition consults, your speech therapist, your wound care nurse. All these people will be working with the same patient. Learn to manage your time when they're at the bedside. A transformational leader uses charisma to motivate others. Definition of health. Health is a state of well-being. Involve the whole person. When you're doing an abdominal assessment, the quadrant with the pain should be assessed last. If you enter a patient's room and you see an unlabeled syringe lying there, you did not put it there, what do? You will throw it in the trash can. Surgical wound drains. How do you clean your surgical wound drains? You clean from inner part of the wound to the outer part. Examples of health promotions. Examples are going to the gym. Noise exposure fits within occupational safety health categories. Keep the noises down on your patients' floors, especially during the nights. Noise exposure are OSHA regulation. When a patient is discharged home or from rehab, assess to make sure your patients, check to see if your patients are going to need oxygen to take home with him or herself. Check to see if your patients are going to need home physical therapy. Primary care prevention. Example is immunization. Primary care prevention, immunization. Example of secondary care prevention, mammogram, colonoscopy. Tertiary level care is your rehab. Nurses must assess patients' income status on admission. Such variables influences your patient's health. Assess your patient's income status. You can have a social worker consult if your patient needs one. On admission, assess your patients for sleep apnea. ask your patients, do you use a sleep apnea machine home? When you assess your patients on admission, notify the doctor so the doctor can order a sleep apnea machine, a CPAP, while the patients are in the hospital. On admission and discharge, assess your patient for needs of assisted devices, walker, wheelchairs, cane, stretcher. Your patients may need assisted devices to function when they go back to their homes. Assessments that indicate lifestyle risk. Example is sunbathing. On admission, assess your patients for sensory deficits in elderlies. You'll assess their vision or hearing to see if they have problems. Maybe it's not that they are not understanding, but if they are not able to see or hear, this will interfere your communication with them. ABG means arterial blood gas. This is a laboratory draw. You send your blood drawing to the lab to evaluate the amount of oxygen that is present in your patient's blood. The scrub nurse in the OR is responsible for handing surgical instruments to the surgeon during surgery. The doctor orders physical exercise. This level of care is primary care. This level of care is primary prevention. Function of the Board of Nursing is to issue a license to nurses. Board of Nursing mandates Managing Nurse Practice Act, investigates allegations against nurses. Major disadvantage of barbiturates is potential for drug dependence. When making a surgical bed, the bed should be left in the high position when you are finished. Restraints are attached to the frame of the bed. Sputum specimens should be collected in a sterile cup. Autoclaves are used to sterilize hospital supplies by using high pressure steaming, which destroys bacteria and spores. Before setting up your isolation precaution, your nurse must know the kind of isolation that is ordered by the doctor. TB patients should be admitted into negative pressure rooms on the floor. You'll use an N95 mask. This kind of isolation is airborne isolation. Please hit the like button. Thank you.